With teeth whitening, there's three major categories that I'll lump teeth whitening into, and the first area or first category of teeth whitening I would consider over the counter, and that would be, of course, anything that you can buy at the store. A great example of this is Crest White Strips. Crest White Strips might be the only one that I would recommend. There's all kinds of whitening toothpaste, and people can use those. I think those work in varying degrees, but Crest White Strips are safe, they're effective. The problem that I have seen with Crest White Strips is that I'll see a person that comes in that's used Crest White Strips and their teeth are whiter, but if they've got any tilt or crookedness to any of their teeth, sometimes when they squeeze those white strips on, it doesn't bleach evenly. So the common thing that I'll see is their teeth are whiter, but some of the teeth will look like they have a little black or darker outline, and so the teeth almost look like window panes. And I've seen that from time to time, and that's a concern. And then the other concern that I have with it is that in order for people to get their teeth as white as they want them, a lot of times they end up spending the money on the Crest White Strips that they could have spent on what the next category is, which is a custom take-home tray system, which is what we've been using in dentistry for many, many years now. And so they've spent more money on these Crest White Strips than they could have just gotten custom trays and done it under the guidance of a dentist. So the next category obviously is the take-home custom trays, and the take-home custom trays are tried and true. It works, it's effective. It's been shown to be the method that will last the longest, meaning that once people get their teeth whiter, it tends to maintain that whiteness longer. Now, one thing people have to remember when they're whitening their teeth is, I use the analogy a lot of times, it's like power washing your driveway. You power wash your driveway, but then, a year or two later, it needs to be power washed again. So in order for people to maintain the level of whiteness, that they have to maintain it at some level. And that not only includes keeping their teeth spotlessly clean, but maintaining their dental appointments with their dentist, but it also would involve them touching up. We call it touching up their teeth. And what I do to keep my teeth white is once a month I'll take my custom trays and I'll put fresh whitener or fresh bleach in there, and I'll wear it once a month. And so that keeps them, it maintains them at a level that I want to keep them, and that's what most of my patients do. The third category is called power whitening, and that's done in the office because the solution concentrations are much higher and they can be dangerous if people use them at home, so they're not really safe for people to be toying around with at home. The great thing about power whitening is that it's fast, and most people want the power whitening now. They'll come in, our busy professionals, the lawyers and the doctors and the guys that are just super busy. They want to get it done now or yesterday, or sometimes they'll come in and go, well, I got the rest of the day off, I want to power whiten my teeth. And so we'll move them down the hall and we'll power whiten their teeth and they'll even tell me, I won't wear the trays. So for some people, this is the best category to use. Whitening in and of itself is unpredictable. Like, everybody has a genetic predisposition. Like, we can only get people's teeth so white. Like, some people come in and we can whiten their teeth to no end, and they're only going to get so white. So there is a genetic limitation for some people. So the determination as to what they choose, like I said, they can do the Crest White Strip or the over-the-counter stuff. I don't love that, and it's not just because it isn't under my supervision, but it's hit and miss, and a lot of times it doesn't work. It's not very effective. So when a person comes in, we're typically either talking to them about doing their take-home whitening trays, the tried and true method, or doing the power whitening. One of the things that we do in our office is we have a program called Whitening for Life. And Whitening for Life involves us making them custom whitening trays. But the great thing about Whitening for Life program is that every time they come in to get their teeth cleaned, they get a new tube of whitener. Just like you get a toothbrush and maybe some toothpaste or some floss that you get in the little baggie. They also, if they're a member of the Whitening for Life program, they get a tube of their whitener, a new tube, so that they can continue to whiten their teeth and touch them up. later, so they never run out. But they have to keep their prescribed 6-month appointment, or if it's 3 months, they have to stay on that. And we usually give about a 30-day grace period. But most people that are in the Whitening for Life period, they stay, within their 30 days of maintaining their prescribed frequency of visits. So, I try to show them that if the Crest White strips are going to cost you $35 and it ends up costing you, and you end up going through 3 boxes, you might as well have something. If it's only going to be $99, that you're going to be able to whiten your teeth for life. After I've talked to someone about whitening for life, if maybe they don't want to do that, or maybe they want to get the instant result, we might do the in-house power whitening. But one of the great things about the in-house power whitening is someone who goes through the in-house power whitening program, which is a lot faster, they get it done, they get the result, is that they're automatically enrolled into the Whitening for Life program. So that's a benefit of doing the in-house power whitening. And what we found is most of the people that have invested the money in power whitening will continue to touch up their teeth. So the Whitening for Life program is wonderful for that. And we've had a lot of people that have enrolled in that program. And that's great for them, and it's good for us because it allows us to keep them on their 6-month appointments, because we want to see them every 6 months, because the more frequently we see them, we can catch things, when they're much smaller and they're early, and to fix it costs a lot less, and it's a lot less painful to fix things whenever they're diagnosed early. Now, the epitome of this, or the best way, the most effective way for someone to whiten their teeth, is a process. And the name of the process is core whitening. It's a system. And what that involves is basically a combination of using take-home trays, which primes the teeth, and then they come in and they have their teeth power whitened. So there's a combination, and we've had tremendous success with that, with people who've even tried the take-home trays and it didn't work, but then we went through the core whitening system process and we had tremendous results. So the core whitening system has been a great advancement in the world of whitening. And it's more expensive, obviously, because you're getting 2 of the systems together, but it is very effective, and it works. So those are the 3 levels: being the over-the-counter or take-home, the custom trays that people can use at home, and then the in-house whitening, and of course the core system, which is a combination of all those.